to another Ask a Director. Today I have someone who has literally saved my bacon. Julie, welcome.
Welcome, yes. Nice to see you again, Holly. I really love the headphones. They are brilliant.
Thanks. They're very comfortable. They're the comfiest headset I've ever owned. I couldn't find my little in-ear ones, so I thought I'd just wear them.
So before we start, can I just say hello to everybody? Obviously, my name is Julie Shepherd. For those of you who don't know me, I'm the Chief Nurse for Northamptonshire Healthcare Trust. And a big thank you for everything you're all doing. I know pressures are increasing. It's winter. Not only is the weather not too good, but actually workloads are increasing. So it's a big thank you from me as your Chief Nurse for everything you're doing and everything you continue to do. So thank you. So Holly, let's get on to the questions.
Yes, let's. So today is Armistice Day, first off. So Julie and I have both got our poppies on, which is really cool. But we just wanted to make people aware that today was Armistice Day, and we've also got Remembering Sunday coming up, where our very own Anne Linswell is going to be laying a wreath on behalf of Team NHFT on Kettering. So just, you know, keep an eye out on the staff room, have a look and have a read of some of the messaging about that, first of all. And now let's kick off with some questions. Are you ready?
Yep, I'm all ready.
Okay, so the first question is a very important question. It's about mandatory vaccinations that we're hearing a lot about in the media at the moment. What does that mean for Team NHFT staff?
So as you know, at the moment, it's around people going into care homes. So it's staff working in care homes, and it's staff going into care homes, which includes any of our staff that go into a care home have to be doubly vaccinated and being able to evidence that. I know Jean and her teams have been doing a lot of work around this, so this shouldn't be new to anybody, because that comes in today from the 11th of November. But you also will be hearing that actually the government have made a decision, haven't they, that anybody who, and this might confuse people, but actually anybody that provides care through a CQC regulatory activity will have to be doubly vaccinated. They're saying doubly vaccinated initially, and that is sometime next year that's coming in. I can't give you the exact date, but it's definitely coming in sometime next year. And we will be able to update you more as we know more. But all our services, as we all know, are CQC regulatory activities and all registered with the CQC. So it's service level. You know, this is not my understanding at this present time. It is not about people that don't work in our services. So it wouldn't be, you know, you wouldn't be included because you're working in comms. You know, finance wouldn't be included. Those sort of services wouldn't be included. You know, it's those that are in the services that are included. But we'll keep everybody up to date as more becomes apparent.
It still seems quite early days, doesn't it? So the information's coming in sort of at present, isn't it? So I guess we'll keep those communications going out there as and when there's more information at hand.
Yeah.
Awesome, thank you so much. Okay, question 2 is a good question because you have a background that features someone giving a vaccination. Someone has asked, are they still able to get their flu vaccine and whether it's bookable or drop-in clinics?
Very good question, Holly. So it is really important that everybody has their flu vaccinations. You know, last year we all wore masks, and actually flu wasn't, you know, we didn't hear about flu. Usually we hear a lot about flu in the winter, that, you know, cases are increasing, there's deaths around flu, but because of COVID we didn't hear that. And because of mask wearing, we've seen a reduction in our own immunities because they haven't developed. So actually we're at higher risk this year. You know, with admissions to hospital and things like that, it is important that everybody has their flu vaccines in the NHS. We do get free flu vaccines. You know, it's not only about protecting your patients, but it's about protecting yourself, your friends, your family, your loved ones, and your colleagues. And actually, it's really important. And is it bookable? Both. So you can book it on the link, which you go to the staff room for. It's on the staff room. You'll see it on screensavers, you'll see it on posters. We're all talking about it. If anybody hasn't got the link, I'm sure if you either email myself or probably comms, we can send it out, but it's ever so easy to find on the staff room. You can book through there. You can find out about drop-in clinics, because we're doing both. The other thing you can do is, if you don't want to come into one of our clinics, you're working from home, you can actually, if you email Evie Underwood, your name, where you work, I think you have to give your employee number and your address. She will post a voucher out to you, which enables you to go to several different places to get a free vaccine, and you don't have to pay up front as we did in the past. You know, we've got some what are called flu vouchers, and we can post those out. So I think that's an important point. If you're over the age of 50, which unfortunately I am, or you're in one of the vulnerable groups, you will be offered it through your GP practice as well. So you can go to your GP practice for that. And we're encouraging people to go every route. And before you ask me, yes, if you have it somewhere else, we can pull the information through. Because one of the things that COVID's done for us is there's some databases that everybody has to put in the information. So one's called NIMS and one's called NIVS. And we upload information up to it, and we can pull information down on our staff. So actually, we no longer need you to report to us that you've had it somewhere else, because that information we can pull down ourselves. So don't worry, if you go somewhere else, we can still pull your information down.
Oh, that's pretty cool, isn't it?
And you know, the other thing is, you can actually go and have your COVID and your flu vaccination together, because our COVID clinics that we're doing at NGH and KGH through Rocky Health, and you can book it through the same link. You can have both at the same time, and I had both at the same time. You know, I did that because I was called by my GP. So actually, while I was in there, I had one in one arm, one in the other. You know,
I did
and
too.
I was fine. Yeah,
Liz Roberson did mine. I did one in here, one in here, and I have to say, it was such a time saver.
Yeah,
because I didn't have to go back in. I really, and I felt fine after both as well. There wasn't, like, for me, there wasn't any side effects. So I really appreciated Liz's soft touch with me.
I know some
really
people do have side effects, but I'm like you, I didn't have any side effects.
No.
Just 2 sore arms, so couldn't roll over that night. But apart from that, I was fine.
That's really helpful. So we'll put all that information and the information about contacting Evie. The other thing I would say is that we do have a couple of case studies, one being Laura Dunsby, who a lot of people around the trust know, who did actually get very poorly this year. So do have a read of that case study. Laura is feeling a lot better, but it's definitely worth having a read if you're still not sure, because she's got a very it makes my heart feel a little bit sad, because we all love Laura, but she's all right now, isn't she? So just a bit tired.
And you know, she talks about her journey, doesn't she? And she had flu for 3 weeks, and she was really knocked up her legs, wasn't she? And she's been on a journey. So I think we're now 2-3 weeks in post flu, and she's getting there, but it's taken her a time. And actually, you'll always remember having flu. So I was reflecting on today's conversation with you. And thinking that I remember having flu when I was a child. You know, I must have been about 10, and I can remember being really, really ill. And all these years on, I still remember it. So actually, it makes you really, really ill, and nobody wants to be like that.
It's definitely not just a bad cold. I feel like that is one of those
it
misconceptions.
really
it's not one of them.
And as I say, it affects children as well, because I remember having it as a child. I nearly told you when, but then you'd be able to work out how old I was. So I'm not telling you.
So, right, with that then, let's move on to question 3, which is, what is the COVID inquiry?
So the COVID inquiry, that is a really good question as well. The UK government has announced it will be launching an independent inquiry into the government and public sector's response to the COVID pandemic. We don't know at the moment what the terms of reference will be for the national inquiry. As I say, it will be a public inquiry, and it will require lots of information, lots of documents, and it's important that as an organisation we start to pull all this together. You know, there has been information sent out to people. Jean's got a working group. We've got a lead within the trust to try and start to pull this information together. So if information is required from you, people will be in contact with you, and there's nothing to worry about. You know, this is thing that we would do as a UK government in relation to any sort of pandemic or any major national emergency like this. I mean, you remember the Grenfell? They had a public inquiry into that, from what I remember. You know, this is a normal practice. It's learning lessons. So actually, if we ever get into this situation again, which I hope I never see in my lifetime, actually we can learn those lessons now. So it is important. So.
It sounds like a massive job, but actually I think you are right. There's that lessons learned piece is going to be so important for, you know, hopefully not in my lifetime either, but you know, if there is anything similar that occurs, we can mobilise differently and mobilise better as a country, I guess, can't we? So it's a really important, really important aspect. But we will link the information that Jean has sent out in this article, so you can read a bit more about some of the information that they're looking for. Yeah,
that's good. Thank you. But nobody's to worry about it. That's the important thing. Do not worry about it.
Thank you. And then the last question is a question that came in that I actually did answer separately, but we thought we'd let people know, is when do Quality Awards close?
Holly, unfortunately, they've already closed. you know, whoever raised that question, they've missed the nomination period. But the good news is, very shortly, I think it's in the new year usually, you can enter the next lot of awards, can't you? Because we'll be looking at 2022.
Yeah, they happen every year.
We're moving towards the virtual ceremony, aren't we, on Thursday the 16th? And I think the important thing is people need to put a note in the diary. It is in the evenings, and in the past, because it's been a face-to-face ceremony, we've had to limit the amount of people that can come. Yeah. But actually, now it's virtual. Anybody across the trust can sign in, can't they? And take part in the celebration. So I think it's important that actually you watch the social media and the comms that are coming out in the next few weeks around the Quality Awards, and actually the links will come out, won't they? And it's always good fun. I remember it last year,
so much
and I'll be there. And I know
I'm
you
so
will
excited.
be.
I can't wait. So yeah, the awards closed yesterday at midnight. So the person actually, I just managed to get back to them just in time. But they closed and they're now going for shortlisting. So yeah, it's all kind of like up and running now towards the award ceremony. So it's super exciting, and I can't wait to see all our staff there. What was really nice about last year is that a lot of our staff also had their families watching as well, which I thought was really it's just heartwarming because it brought so many different people together.
Yeah, and I think that's with doing it virtually, more people can be there, can't they?
Yeah, absolutely.
More people can take part. And a lot of organisations have done virtual awards, and they've been very successful. And last year's was successful. And I know Suze, who leads on this in the comms team, will certainly have built on last year's, knowing what Suze is like. So I'm really excited to see this year's. You know, it's definitely in my diary. I'll be there.
Good. I'm really glad to hear it. I'll let her know. So that's all the questions we had for you this week, Julie. And you've said your thank yous already. So unless there's anything else, anything last minute you want to say?
No, I don't think so. You know, it's a little while since I've done Ask a Director. Now, one of the questions you haven't asked me,
which
I would like to say, is that we're awaiting new infection prevention national guidance, and it's not out yet. And I just want people to know, as soon as it is out, we will start working on it. But actually, it was due out the middle of October, then it was due out in the middle of November. But actually it's not out yet. It came out in draft for consultation, and my understanding is they got over 15,000 pieces of consultation nationally, so they've got a bit of work to do on it. So I can understand why it's been delayed, but hopefully it should be out soon, so watch this space.
Well, that's really interesting. It's one of those things where you may not often think that they're going to change things, but it's really good to know it's coming, because obviously it means that everyone can kind of keep an eye out. And it's such important information to read and to familiarise yourself with.
Yeah.
So, yeah.
And we will update trust policies, and people will need to wait for us to do that, and we'll do it as quick as we possibly can. But actually, we always take the guidance, interpret and write, our local policies. So as soon as we can, we will do. But we're on it as soon as it'll be out. So anyway, it's great to see you.
Thank you. You too.